Hey, what's up everybody, and welcome back to the Sanctuary. I'm your host, Professor C, and we're going to do some more A&P today. Specifically, I'm going to take you through the overview of the facial bones. So, let's do it. Alright, we have a pretty good look here on the left of the facial bones with the cranium removed. And here, the little skull right there I'm putting the check by. We will be talking about the bones that, of course, make up the face here. And then we'll go one by one through the bones in the future lectures. So 14 bones. What we're going to find out is there's 6 pairs to give us 12, and then there's 2 singles. The mandible, which is the lower jaw, and the vomer, which is the little blue guy right here. We're going to see all those more in detail in a moment. So what do these bones do? Well, obviously they provide the framework for building anything on top of the face like musculature that would attach to the bones to allow you to make facial expressions or to communicate non-verbally. Of course, the teeth are attached to 2 of the bones we find in the face. We have the upper tooth-bearing bone called the maxilla and the lower tooth-bearing bone called the mandible. Of course, you have both the openings for what we will call the mouth and the nose once we can build them with other tissues. And of course, this provides an opening for air and food to enter the body. We also have cavities, holes, foramina, meatai, a variety of terms for structures that allow us to gain special senses like sight, taste, and smell. All right, let's take a peek at each of them individually. Lacrimal bone. The lacrimal bone is in green. Lacrimal refers to tears. So if you're going to look for tears, look for somewhere where, on the medial portion of the orbits. And it's these little green guys right here are called the lacrimal bones. And it's not the best way to see them, but they're very small, and so they're hard to see. Nasal bones are these 2 blue guys that I'm putting these arrows to right here, right, that make not quite what we call the nose, but the bridge of the nose, right? If you wear glasses, this is where the glasses would sit on your nose, and not on the fleshy cartilaginous part that sticks out of the skull, but this bony part, the nasal bones. The vomer is this plow-shaped bone right here that I'm circling. And it's this little blue guy. And in this smaller picture down here, I can see the vomer is also colored blue right there where I'm circling in red. The inferior nasal conchae. If you caught the previous video on the ethmoid bone, you heard me reference this already, but it's these little green boogers that are in the nasal cavity there, the inferior nasal conchae. They are considered to be a pair of facial bones. They are not considered to be cranial bones, and they are not part of the ethmoid bone. Maxilla is the upper tooth-bearing bone, and it is considered to be 2 different bones that are fused together. Zygomatic bone, another one we've referenced in previous talks, is the cheekbone. I'll just put a little Z there to show that is the zygomatic bone. You may have heard of the zygomatic arch, and as the construct of pretty much all these bones together, forming what we call, well, the cheeks. Mandible, of course, is the lower tooth-bearing bone. Almost everyone's heard of this one. And sometimes it's called dentary, especially if you're wanting to study animals or you want to work in a zoo and you're going to learn A&P of animals, mammals. You will see it's called the dentary bone sometimes, like a dentist, right? The palatine bone, and notice how it's spelled, it does not have an N here. A lot of people try to put an N there and call it palatine, almost like Valentine, but it's not. It's palatine, sometimes pronounced palatine, and it's this little gray bone right here that I'm circling, and you can only see this if you look at the roof of the mouth and a portion of the mouth, what we call the hard palate, which is where they get their name from, the palatine bones. Again, just to know where we are here, I can put a big T for temporal. Studied that in the past lecture. There is the greater wing of the sphenoid bone, so I can put a sp for sphenoid. I know this is the frontal bone, making up the superior portion of the orbits. And then here's Mr. Zygomatic, no problem. Here is ethmoid, And again, we can only see that outer portion of the cribriform plate. If you want, go back and watch my ethmoid video, and it'll help you out more on that bone. But from this aspect, we can only see a tiny portion of it and the inner wall of the orbit. Now, lacrimal bone is the one that I said was going to be in green, and there it is. I'll put an L on it, just like this, the lacrimal bone. And there's a small, well, a basin. And we learned that one of the words for a basin is a fossa. So we have the lacrimal fossa. It's actually in between the lacrimal bone and the maxilla, that top tooth-bearing bone. So inside the lacrimal fossa would be things that you would think of like what we call the lacrimal apparatus, or structures that help you produce tears. Remember, anything lacrimal has to do with producing tears. Nasal bones, again, I'll put an N here. We saw those just a moment ago, but they form that bridge of the nose, not the actual nose that would stick out, that's soft tissue. Maxilla I've already labeled, the upper tooth-bearing bone. Zygomatic I've already labeled, the cheekbone, very prominent from this aspect. And of course the lower one is the mandible, that almost everyone knows about, the lower tooth-bearing bone, the movable jawbone. All right. The nasal septum. Again, I've talked about this when I talked about the ethmoid bone, because the two bones that make up the nasal septum, at least the bony portion, are the ethmoid and the vomer. One of them, the ethmoid, is a cranial bone. The vomer is considered to be a facial bone. Now, the part of the nose that sticks out, which gives us that, that fleshy, kind of almost bendable part of the nose, the apex of the nose, is made of cartilage. And so when you see a skeleton, you don't see the nose as you think about the nose, because it's not bone, and it's not shown on the bony pictures. So just to remind us, the perpendicular plate of the ethmoid bone forms the superior part of the nasal septum. And if I could look at the skull on the right-hand side, I can highlight that right like this. That orange thing hanging down is the perpendicular plate of the ethmoid bone. The bottom part is the vomer. Again, it's this blue plow-looking bone that's underneath it. That forms the inferior portion of the nasal septum. Septal cartilage, as I just said, forms the apex, or the point, of the nose, which is why it's not shown on bony models. If you've ever heard of a condition known as a deviated septum, it's just simply where the septum is not in a normal position, meaning that it's been pushed apart or away to one side or the other. And that's simply what a deviated septum is that it's deviated from its normal position. So the septum is displaced to one side. This makes one nasal passage smaller or more constricted than the other, and can lead to a variety of different problems that you may want to deal with some sort of surgical procedure. All right, thanks for watching that one. If you want to see more details of each of the facial bones, check out the other videos that I have in the series. All right, bye-bye.